Ulnar artery in the forearm gives various muscular and cutaneous and genicular and autonomic branches. But the largest branch from ulnar artery is common interosseous artery. Remember this point. It is the largest branch of ulnar artery. Although it's a very small artery. Then this artery, you can see here, it descends downwards and laterally and reaching to the upper border of the interosseous membrane, where it splits into two branches, anterior interosseous artery and posterior interosseous artery. Again, the same funda will apply which I told you for the terminal branches arising from the medium sized artery. So among the two, posterior interosseous artery is a minor branch of common interosseous artery. Why? Because in the back of forearm you have less of bulk of muscles, one thing. Then it mainly supplies blood into the upper two-thirds of the back of forearm. Now talking about the anterior interosseous artery. Anterior interosseous artery is the major continuation, or you can simply write it as the continuation of common interosseous artery in forearm. The reasons are that anterior interosseous artery being of wider caliber, one thing is the bulk of the muscles in the front of forearm is much more compared to the bulk of muscles in the back of forearm. So more of requirement of perfusion here in the front of forearm. Another thing is it also provides nutritional branches to radius and ulna. So you've seen that there are two reasons. Then the third reason for it being the major branch from ulnar artery is that in the junction of the upper two-thirds and lower one-third, this anterior interosseous artery, it dips down here. It dips down by perforating the interosseous membrane and reaches into the back of forearm, thereby reinforcing blood in the lower one-third of the back of forearm. As I told you, that posterior interosseous artery was mainly supplying blood in the upper two-thirds of the back of forearm. So this artery reaches behind in the back of forearm and it passes below the fourth compartment of the extensor retinaculum. So it's an anterior interosseous artery, but it passes below to the extensor retinaculum. What about its continuation here in the lower one-third of the front of forearm? So the continuation of this anterior interosseous artery in the front of forearm in the lower one-third is sometimes called by some authors as median artery. And it participates in a cruciate anastomosis here.